My name is DJ Chuang, a board member of Asian Mental Health Collective, AMHC. Our website is asianmhc.org. And I just want to take a few minutes, share with you how we were able to do what we've done in the past 4 years or so in really serving the Asian American mental health needs of our generation, particularly those between the ages of 18 to 34 in the United States and some around the world, especially those who are English speaking, using the freely available tools of social media, especially Facebook and internet and some occasional Zoom meetings and other things. So we're best known for our Facebook group, Subtle Asian Mental Health, that now has over 61,000 members. Over 10,000 or so are active every month. And we got there partly because of timing, but also partly because of a meme. One of these viral ideas that just grew like crazy during those COVID years when we were all locked up at home and safe in isolation, but it also harmed our mental health and community. And so we came together online. The big viral idea was subtle Asian traits, and that spawned off all kinds of other subtle Asian groups and memes and blogs and Instagram and podcasts and things like that. So a couple of our co-founders started Subtle Asian Mental Health, and it's just grown by leaps and bounds over the years. And what's been amazing is we did all that we did during the past 4 years with no budget and no staff, 100% volunteers. So how did we get to 61,000? Well, at the beginning, it was an open door, so we had all kinds of people come through. But we soon realized with so many people sharing the mental health journeys, some anonymously, some actually put their names on it, we needed moderation. And then we needed some ground rules. And then we needed some vetting to let people know upfront what the rules are and let the members in one by one. So currently we have me, who helps with admitting members. I think Facebook calls them approving the members. And then we have two moderators that actively check every post that's submitted to make sure they are on topic. And as you imagine, if we have 61,000 members, there are many off-topic conversations as well. So some of those posts get thousands of views, some get a couple hundred, but very active, everyday conversations about Asian and mental health. Now, we've also had other people that saw a need and just took action. So we're a very empowering organization, not a lot of structure or leadership, and yet people have been generous to support our work. And so to help facilitate that, we set up a nonprofit. And since we're not paying staff or have a lot of expenses, then our funds have grown over the years. And recently, back in the March of 2024, we hired our first executive director. And just a couple weeks ago in Atlanta, we had our first staff and board retreat. So we are beginning to really think through how we can make the best impact for us in the tremendous need of Asian American mental health. And so we're in process of developing that, being strategic and good stewards of our funds, as many of our supporters and donors, as well as corporate sponsors, have really wanted to help advance this cause. So we're grateful for that. Some of the other things that we've been able to do with just volunteers, and occasionally we pay contractors to build a platform to do our digital outreach. We have the largest Asian American mental health therapists directory for the US and Canada, over 2,000 in the US with 20 languages, as well as in Canada, over 200 or 300 now. We also have a Lotus Therapy Fund that has subsidized therapy to provide access for hundreds of Asian Americans in need, as well as a Lotus Training Fund to provide continuing education and scholarship for those that want to learn how to provide counseling therapy for Asian Americans. We also have clinician-led support groups. We also do an annual online event called Transformation to raise awareness, provide education, and also provides a little fundraiser. And occasionally we have a few other programs, but those are kind of our main things that we have done consistently over the years. As we saw need and volunteers wanted to step in and do those things, we just did them. So there wasn't a lot of thinking or overthinking or structure, but we're at a point now, we've been very fortunate and blessed to have the funds to really structure for more intentional growth and program to increase our impact even further. Thank you for watching this video. Would love to hear from you. I'll add a email address and our website in the description of this video. Would love to hear from you and help your initiative, project, organization, or small group of people to make a difference in Asian American mental health.